fingers. Hi, Katie.
Hi.
I'm Dr. Matt. I'm going to do your exam today. Thanks for coming in. Let's go ahead and verify your chart. I want to make sure that I have all the right information.
Okay.
Can you please verify your date of birth?
March 23rd, 1988.
Okay, do you have any allergies?
No. Just a pollen.
Okay.
Yeah.
Are you taking any medications on a daily basis?
No.
Okay, and you're here for a head-to-toe exam.
Yes.
When was the last physical that you had?
It was a year and a half ago, yeah.
Okay. Okay, I'm going to ask you a few questions about your medical history. Are you experiencing any joint pain?
No.
Okay. Have you had any surgeries in your lifetime?
Yes, I've had two. I've had a bunionectomy and RCPD surgery, and they both went really well.
Perfect. And when were they?
The bunionectomy was 2013, and the RCPD was this August.
Okay. And no complications, you said? Alright. Any injuries that I should be aware of?
No, I've been having some leg pain lately, and I'm not sure if that's due to an injury while running or not, but just around my knee.
Leg pain. Okay.
Yeah.
And for how long has that been going on?
About a month. Yeah.
Is it in both legs?
No, it's mostly my right leg.
Right leg. And how would you describe the pain?
It's like a soreness that sometimes gets so intense, especially at night, that it feels like sharp pain.
Okay. Do you feel any tingling sensations?
Not that I've noticed, no.
Okay. Are you experiencing any cramping?
No.
Okay, so you say mostly it feels like soreness. And you also jog?
Yes.
How often?
I run for 40 minutes. I try to every other day, sometimes less during the cold months.
Okay, for how long have you been doing this regimen?
I do it every summer, consistently all summer, and then I slow down in the wintertime. So for about 10 years. Yeah.
Okay. So that's a good indication that maybe running isn't what is causing the soreness.
I don't think so, because it's not equal. I mean, it could be, but that's not my instinct.
And have you noticed your reflexes being a little bit slower?
A little bit, yeah.
Okay. Any difficulty blinking or swallowing food?
No.
Okay. Any other pain, muscular, that you would describe in your back or?
My back gets tense from time to time, but I know it's from just anxiety issues. Like there's no sharp pain or injury related. It gets tense.
Okay. Have you noticed any changes with your vision?
No.
And you wear contacts, correct? Okay. What about your hearing? Do you hear any buzzing or sounds that may not be here?
Some tinnitus every once in a while, like a ringing, but it hasn't changed for the last like 15 years, just from time to time.
Okay, so it's chronic.
Yeah.
And that's only in your right ear?
Both ears.
Both. Okay. Was it diagnosed by a physician?
No, I just
realized
heard
it.
ringing and I looked it up and just talked to friends, and I think it's tinnitus.
Okay. And did you take any medications that might have caused it?
Not to my knowledge, no.
No injuries to the head?
No.
Okay. Okay, so I'm going to start this exam with vital signs, and I'll listen to your heart and your lungs to make sure that everything is healthy.
Okay.
Okay, I'm just going to put gloves on. Have you noticed any flu-like symptoms in the last 48 hours?
No.
Do you experience any pins and needles anywhere in the body?
No, just like when my foot falls asleep if I've been sitting on it weird, but nothing outside of that.
Okay. So I'm going to take your temperature first. This will go under your tongue. I'm going to have you hold it for me. Thank you. And we'll measure your oxygenation as well and your heart rate. Okay, let's go ahead and check this. 98.1, that's perfect. And 96 percentile room air, that's good, and heart rate is 60. Okay. Is it okay if I use this arm? Okay. So I'm going to match the artery. Perfect. We're using the right cuff for this. Okay. This is going to feel a little bit cold. Go ahead and uncross your legs and relax. Blood pressure is 98/60. That's normal. Okay. So I'm going to start with a gentle scalp and face palpation. Alright, so go ahead and relax. Okay, I'm going to apply pressure on both sides of the head at the same time. Go ahead and tell me if you feel pain.
No.
Okay.
No.
Okay, I'm going to check your scalp. Scalp is very clean. Looks like there's no redness and even distribution of the hair follicles. I'm not noticing any signs of alopecia. No signs of dehydration. The hair looks very healthy and even distribution. Okay, so let's go ahead and check your vision. I'm going to ask you to look straight at my nose. I'm going to flash a light in your eyes. We're going to check pupil dilation and constriction. Very good. Okay, go ahead and follow the light with your eyes only. Don't move your head. Okay, now go ahead and look right here for me. Now look here. Okay. Going to check inside your mouth. So I'm going to look at the tonsils. Okay. Not noticing any redness. Go ahead and say ah. Alright, are you experiencing any throat pain?
No.
Okay, let's go ahead and check your sinuses. So I'm going to palpate right here in between your eyebrows.
Okay.
And right under your eyes. I'm not feeling any swelling. Okay. Go ahead and smile for me. And frown with your eyebrows. Good. Puff your cheeks. Keep them puffed for me. Don't let me unpuff them. So try again. Don't let me unpuff them. Okay, good. Very good. Go ahead and relax. I'm going to put my hands on your shoulders. Go ahead and shrug them. Okay. And I'm going to try to push your head to the right. Don't let me do that. Okay. Alright. I'm going to palpate your mastoid bone now. Looking for any signs of mastoiditis. And any pain when I pull up on the...
No.
Okay, go ahead and close your eyes. Go ahead and tell me with which ear you hear the sound.
Left. Right.
Okay. Going to take a look inside your ears. Right. Tympanic membrane is spur gray. I'm not seeing any redness or pus. The canal is relatively clean and very good. It looks like you're not inserting the Q-tip inside. That's
No,
good.
yeah.
Okay. Right here has clean tract. Tympanic membrane is well marginalized. No fluid buildup behind it. No redness. No signs of infection. And the hearing seems to be normal. Let's go ahead and check with a tuning fork.
Okay.
Go ahead and tell me when you don't hear this sound anymore.
No. No.
Now tell me which position here is louder, position 1 or 2. 1, 2.
2.
1 or 2.
2.
Okay, that's good. Alright, so I'm gonna have you change into this gown, and when I come back, I'll do a full body exam as well.
Okay. Thank you.
I'm going to palpate your lymph nodes. We're looking for anything that is swollen. So we have here submental lymph nodes, followed by cervical and preauricular. And postauricular lymph nodes, which are a little bit down the neck, behind the ear. Moving down the neckline. Right above the clavicles. Okay. And cervical occipital lymph nodes, which are a little bit behind the neckline. Okay. I'm going to listen to your heart. Is it okay if I open the gown? Yes. Okay. So I'm gonna have you breathe normal. can hear only S1 and S2, no S3, no S4. We're going to check for murmurs with the bell. For this, I'm going to ask you to take a deep breath and hold it for 3 seconds. 1, 2, 3. Breathe out. Very good. And now go ahead and breathe in and exhale. Good. Breathe in and exhale. Okay. I'm going to listen to the jugular as well. So we're looking for aortic stenosis or bruit. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Now I'm going to compare with the other side. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Okay. Going to check your facial reflexes. So go ahead and relax. You're just going to feel a gentle tap. Relax your jaw. So we're just tapping on the bony prominences. Okay. I'm going to check your scalp sensitivity. Okay, now we're taking a better look at the scalp. We're looking for swelling and any fluid that is building up. I'm going to do a few tests here. Go ahead and tell me if this feels cold or warm for you.
Cold. Warm. Cold. Warm. 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 Cold.
Okay, now I'm going to touch you with two textures. One is going to feel sharp and the other one is going to be dull. This is what sharp is going to feel like. And this is what dull is going to feel like. Go ahead and confirm if you felt those.
I could barely feel the dull one.
Okay. So let's go ahead and try and see how this does. Go ahead and tell me if you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp.
Okay.
Sharp. Dull. Dull.
Okay. Very good. I'm going to start with the lower body now and examine your abdomen as well. Is it okay if I open the gown? Okay, so I'm going to take a look at your abdomen. We're looking for any redness. Okay, first I'm going to visualize. I'm noticing a little bit of swelling that just want to make sure it's not related to any organ. I'm not noticing any redness. So first I will listen for any normal sounds. It's gonna feel a little bit cold. Normal activity is heard on all four quadrants. I'm listening to the aorta for any buoy. Going to palpate, starting with liver. We want to make sure that margins are right under the rib cage. Also, I'm not noticing any swelling. Okay, let's go ahead and take a few measurements. We're looking for inflammation that would be triggered by asymmetry. Okay. Go ahead and tell me if you feel this on the left or right.
Left. Right. Right. Left. Left. Right. Both.
Go ahead and tell me if you feel this 2 or 1 pressure point.
2, 2, 1, 1, 2, 1, 1, 2, 1, 1, 1, 2, 1, 2.
Okay. Go ahead and take a look at your back. I'm going to take a look at your skin on the back. I'm noticing that you do have more than maybe 50 moles, so you need to take extra precaution with sun exposure and to minimize toxins. Looking at the back and musculature to see if there is anything swollen. Could you take a few measurements? We're checking for asymmetry and inflammation around the spine. You did notice that you were having a little bit of tense muscles due to anxiety. I just want to make sure that physiologically everything is normal, that there's no fluid buildup. Okay, first I'm going to listen to your lungs. Go ahead and take a deep breath in and exhale. We're looking for any abnormal sounds. Again, breathe in and breathe out. Breathe in, breathe out. And again, breathe in and breathe out. And again, breathe in, exhale. Breathe in, exhale. Breathe in, exhale. Okay, then go ahead and breathe normal. You can breathe normal. Going to do a skin perfusion test. A little bit more flexibility on the right side. I'm going to test your dermatomes. Go ahead and tell me if you feel this cold or warm.
Cold. Warm. Warm. Cold. 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 Warm. Cold.
And I'm going to touch you with two textures. One is going to be sharp and the other one is going to be dull.
Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. sharp, sharp, dull, dull, sharp, sharp, sharp.
Okay. Looks very good. I'm going to check your legs now and your feet. Okay, Coyote. I'm noticing a little bit of bruising around the second toe. And I know you mentioned that you jog a lot, so maybe we can recommend switching shoes and finding a better support for your feet.
Yeah.
Okay. Let me know if you feel any kind of pain. So I'm expecting that you'll feel a lot of soreness like you described.
Yeah, a little bit there.
Okay. We might experience a little bit of maybe a fissure of one of those bones that connect together. And the only way to tell if that's the case is to do an x-ray and check for any bone fracture. Just going to take a look in between the toes to see if there is any cracking of the skin. You mentioned your right leg was the one that was causing you a little bit of extra soreness. Go ahead and wiggle your toes for me. Okay, that's symmetric. And close your eyes. Tell me on which foot you feel this. Okay, and this. And this. And this. Good. Going to check your reflexes. Good. You did mention that your reflexes were also diminished, so I would say bilateral too. Going to check your pulses. 2+, strong. Okay. Capillary refill is within 2 seconds. It's very normal. Go ahead and tell me towards which way I'm moving your toe, towards you or towards me.
Towards me. Towards you.
Okay.
Towards you. Towards me.
Okay, very good. I'm going to check your Babinski reflex. Okay. Okay. Perfect. Go ahead and wrap your toes around my fingers. Very good. I'm gonna try to push the feet towards me. Don't let me do that. Okay. I'm gonna try to push them now towards you. Don't let me do that. Very good. I'm gonna try to open them. Don't let me do that. And close. Okay. Very good. So go ahead and turn on your belly. I'm going to take a look at your calves and see if there's anything that we can do there.
Okay.
Okay, so just pressing right behind the knee capsule to see if there is any swelling. Going to check for asymmetry. Okay, I'm going to try to push down on your right leg, and in the same time, go ahead and try to lift it up, okay? Go ahead and try and lift it up. And resist. Good. We'll do the same thing on the other side. And resist. Good. Okay, so bilateral strength, I would say 3. We're going to go ahead and do a lymphatic massage. This is an anti-inflammatory oil that helps with lowering fluid buildup. It increases circulation in the area, so the soreness is definitely going to decrease. We're just slowing, moving up the lymph so that we can equilibrate the system. This is going to feel a little bit cold. I'm applying cryotherapy to the muscles, cells to lower inflammation in the body. Using a little bit of manual therapy to increase circulation. I'm going to go ahead and just take a look at your chart. So we did a very detailed full body exam. I did notice a little bit of swelling in the back, so I do want to do more testing to make sure that it's just muscular. And then we did do a lymphatic massage that will help with the soreness you're experiencing in the legs. Okay, and I would like to see you back again in about 2 weeks. We can definitely do another lymphatic massage and see how the soreness feels. I don't want you to take it slower unless it really bothers you, the pain. Because I want your body to get used to running and being active. But we definitely don't want you to be in any pain so that, it's not any discomfort. So if you need to come in sooner, just go ahead and give us a call.
I will, and it felt really, really good. So thank you for the treatment in addition to the exam.
You're welcome.
All right.
Very nice to see you.